and prevention.
And tonight we debut the final part of a KVAL mini-series called I Have HIV, and KVAL's Kelly Andersen tells us the story of a variety of people battling the disease right here in Oregon.
Last week, we introduced you to Joelle, a woman who lost her brother to HIV about 17 years ago. Today, nearly 7,000 Oregonians are living with the disease, and that number is still growing. In our fifth and final installment of the series, we introduce you to a local man whose name we've chosen to not use. He's asked us to omit his face and his identity because the stigma behind HIV is still very real for him, even 30 years after being diagnosed.
Sometimes if I pull on it, it's a little more visible.
Some scars are more than skin deep.
Here I am going to NA and try to keep drugs out of my life. Yet I'm forced to take them every day because of this program.
The drugs used to be speedballs, a cocktail of heroin and cocaine injected directly into the veins. But today, 30 years after the needles gave him HIV, the doses he's taking are not a choice. They're required for his health.
It's better than coming down with AIDS, but it's poison. I mean, it's not. Your body is not meant to have these chemicals in them.
Medication has allowed him to live AIDS-free, and he says he's never felt the symptoms of his HIV.
And I attribute it to the fact that I have been clean. I stopped using drugs. I'd stopped drinking.
All things considered, he says he's lucky.
Good idea.
But what if today's resources existed back in 1989?
One way I think that it could have been prevented is if there was more needle exchange availability.
Today, the HIV Alliance spends $125,000 of private funds on syringe exchanges. It's a preventative approach to HIV. Drug users trade their used needles for clean ones, no questions asked.
We don't really see a lot of new infections for people who inject drugs because needle exchange is a very efficient way to stop the transmission of HIV.
The less people are sharing needles, the less likely they are to get HIV. Renee Yandel, executive director of the HIV Alliance, says syringe exchanges do not increase drug use, but they do decrease transmission, saving lives as well as cost.
I mean, if you think about the cost of an HIV infection, can be $600,000. The cost of a syringe is 9 cents. The cost to run the syringe, you could run the syringe exchange for 5 years for the cost of one infection. I mean, it's incredible. It's an incredibly cost-effective program.
At both the mobile and on-site exchanges, recipients of the needles are provided with information on both addiction and HIV resources.
Because when someone's facing an active addiction, it is very hard for them to prioritize a lot of things related to their health, and HIV being one of those things.
This man did make it a priority. Today he's sober. The only evidence of his past, the fading scars left by his battle with drugs. It's the unseen but ever-present HIV that he's worried has marked him.
Unfortunately, even though there is a lot of information these days about the contagioncy of the disease and a lot more, people still hang on to these old suspicions.
If we could see HIV for what it is and what it is not, there would be less room for speculation. The facts are there. Perhaps we just have to look a little closer. The HIV Alliance urges the public to get tested and to practice safe sex. You can help the fight too by volunteering, donating, and just getting educated. This is the final part of the series, I Have HIV, and you can find the other 4 stories on our website. That's kval.com. Live in the studio, I'm Kelly Andersen. We'll be right back.
After years of lots of dental bills and crowns,